A warm welcome to this talk, Tuesday the 4th of June. Now there's a couple of important articles just out in the last day or two. One is from the scientific medical literature admitting the reality of vaccine injuries and the possible extent of vaccine injuries. Another is from a relatively mainstream media outlet. So let's get straight into this now. And this could be the start of the shift towards realistic analysis that we're looking for. There's many forces trying to stop that, but let's get into what we have got here. So this is excess mortality across countries in the Western world. This is the paper, and it's from the British Medical Journal Public Health. Very thorough paper, but readable. It's all there. It's freely available. They've kindly kept it in the public domain so you can check it out for yourself. Now let's get straight down to some of the things that they are saying here. This is from the article that I've just looked at. By definition, these serious adverse events, vaccine adverse events, lead to either, I don't know if I'm allowed to mention that complication or not. It's rather confusing, but that's the complication there anyway. Are life-threatening, require inpatient or prolongation of hospitalisation, cause persistent, significant disability or incapacity. And this is really the first time this is starting to be talked about. Concern a congenital abnormality or birth defect. Congenital means present at birth, usually indicating abnormal fetal development. Or include a medically important event according to medical judgement. So that is directly from this paper that we've just looked at, published in British Medical Journal Public Health. And I think you'll agree it's a level of frankness that we haven't seen before. The paper is still somewhat circumspect, but it's a level of frankness we haven't seen before. Now, the mainstream media in my country remains fairly pathetic. The Daily Telegraph is a bit of an exception, it must be said. This is their headline here. COVID vaccines may have helped fuel rise in excess deaths. This is from direct quote. This is the heading, in fact. COVID vaccines may have helped fuel rise in excess deaths. Experts call for more research into side effects and possible links to mortality rates. So mainstream media, at least Daily Telegraph here, openly talking about part of the cause of the excess deaths that we've been talking about for several years now on this channel, literally several years. Could be iatrogenic, caused by these interventions, these medical interventions. Now, this is, as we said, British Medical Journal Public Health. Now, first of all, we notice that the authors from the Netherlands, notice this paper's from not the United States, not the United Kingdom, not Canada, not Australia, not New Zealand. No, it's from the Netherlands. But we notice, first of all, that the authors have declared no competing interests. Would it be that all journals, all scientific medical journals, could put at the top no competing interests? Wouldn't that be nice? But it's not a situation we are in, unfortunately. But it is a situation that is in this particular paper. They say excess mortality has remained high in the Western world for 3 consecutive years. Western world, 3 consecutive years. Despite the implementation of COVID containment measures and COVID vaccinations. So really, if these methods were so effective, you'd expect these to bring the mortality way down, but it has. That's not what we see. And they say that this increased mortality raises serious concerns. Direct quote from the paper. And of course, we agree. Government leaders and policymakers need to thoroughly investigate. Any investigation would be good, but a thorough investigation would be better. I mean, anything would be better than what we haven't got now. I mean, basically what we've got now in Parliament, for example, is widespread denial. Just recently, the Prime Minister stood up and said the COVID vaccines are safe. Just no acknowledgement at all, but now we're starting to see it, which is why this is so encouraging. And this could be the start of something big. I really hope it is the start of an honest discussion. Insight into excess death rates in the years following WHO's pandemic declaration is crucial for government leaders and policymakers to evaluate their health crisis policies. So their health crisis policies, of course, included their vaccination programs. All-cause mortality report from Our World in Data, 47 Western countries, and the comparators is historical deaths from 2015 until 2019. And of course, they account for seasonality on all the other factors that you and I can think of. They have accounted for, and they've used pretty sophisticated statistics. I didn't pretend to understand all of the statistical equations included, but the conclusions that they come to are clear. Total excess deaths, 1st of Jan 2020 to the 31st of December 2022, 3,098,000. Excess mortality from 2021, 42 countries. 89% had increased mortality, and in 2022, 91% had increased mortality. And of course, we know the countries that didn't have as much increased mortality are often the Western countries, but the Eastern European Western countries where vaccination rates were lower. Not saying it's the cause, but that is an observation that we have all made. In fact, fairly obvious observation, really, to be quite honest. Sex deaths. Now here we are. 2020, 2020, 2021, 2022. Right, 2020 over a million excess deaths, and what they do is publish the P scores. Now the P score is the percentage above what we would expect, so 11.4% higher than would be expected as an average for the 47 countries. 2021, when the pandemic was dying down, we had mass vaccination. Oh, look at that, it went up to 13.8% higher than we would expect. 1,256,942 excess deaths. Horrendous numbers. 2022, 808, and of course by now we're well into the Omicron era. These are not all, the vast majority of these are not attributable to COVID by any way, shape or form. 808,392 excess deaths, with the excess P score 8.8% more than we would expect. Conclusions in the paper: excess mortality has remained high in the Western world for 3 consecutive years. 3 consecutive years. Despite the implementation of containment measures for COVID-19 and the vaccines, this raises serious concerns. Serious concerns. This is a lot of people dying. Government leaders and policymakers need to thoroughly investigate, as we've said. Now, that's basically what that was about. I'll just give a graphic here that they do include the cumulative excess deaths. And we see that the numbers really are quite high for the, as it keeps going up and up and up and up, for the 47 countries concerned. Now, I do have some more really quite interesting information. So if you want to stick around for more information, just give me another 5 minutes and it will be quite illuminating. The secondary analysis of the placebo-controlled phase 3 randomized clinical trials of the mRNA COVID vaccines. And we did interview the author of this, Joe Freeman, about this. It shows that the Pfizer trial had a 36% higher risk of serious adverse events in the vaccine group as opposed to the placebo group. So 36% higher risk, 30% higher risk. If people had told you this before we got vaccinated, wouldn't have touched it with a barge pole. Really, why weren't we told this in the original trial? Why did it take Joe Freeman to do a secondary analysis and his team to do a secondary analysis, as well as doing his day job as a doctor? Quite incredible. Anyway, that's the figures. 36% more serious adverse events in the vaccination group compared to the placebo group. The authors of the secondary analysis point out that most of these serious adverse events concern common clinical conditions. Now, these are common conditions that people get all the time, so very often they weren't linked to the vaccine. They just thought part of the rough and tumble of life. Disease occurs, unfortunately. So a lot of these are common clinical conditions. For example, ischemic stroke, lack of blood supply causing to the brain causing a stroke. Acute coronary syndrome, that's disruption of the blood supply to the myocardium, the heart muscle, and bleeding into the brain. But the fact that these are all common, of course, we see these all the time. Ischemic stroke, we see it commonly. Acute coronary syndrome are very common, very common. ST elevation, myocardial infarction, non-ST elevation, myocardial infarction. We see these commonly, with these being common, this commonality hinders clinical suspicion, and consequently, its detection as an adverse vaccine reaction. So it hinders clinical suspicion. These are happening all the time. So your dad or your uncle comes in with a whatever it is, ischemic stroke, acute coronary syndrome, brain hemorrhage. Sadly, that happens. Very often not attributed to the vaccine, even though it may be caused by the vaccine. What have we been missing here? Quite a lot is probably the answer to that question. And that's why it's so important to look at excess deaths, why this is such a vital study. These reactions include other adverse reactions: cardiovascular disease, heart and blood vessels, coagulation, excessive blood clotting in the blood vessels, hemorrhages, bleedings, gastrointestinal events, stomach, colon, small intestine, thrombosis, blood clots. Numerous studies have reported that COVID-19 vaccines may induce myocarditis, inflammation of the heart muscle, pericarditis, inflammation of the lining around the heart, autoimmune disease, where the immune system starts attacking the body's own tissues. Post-mortem examinations have also ascribed myocarditis. Encephalitis is Encephalitis is inflammation in the brain. So encephalitis, inflammation in the brain, possibly for autoimmune reasons. Immune thrombotic thrombocytopenia, so blood clots reducing the amount of platelets, causing further hemorrhage. Thrombocytopenia. Intracranial hemorrhage, that's bleeding within the cranial vault of the skull, intracranial hemorrhage. Diffuse thrombosis, little blood clots everywhere, to COVID-19 vaccinations. Pulmonary embolism, blood clot in the pulmonary arteries. Acute myocardial infarction. Immune thrombocytopenia and disseminated intravascular coagulation. In other words, in the blood vessels, blood clotting all over the place, disseminated intravascular coagulation. As I say, it's only the Daily Telegraph. I haven't heard this reported on other mainstream media outlets in the UK. But we have a peer-reviewed scientific paper here, and that is a very major shift to greater objectivity and appreciation of this matter. How many years will it take to come out? It took the infected blood scandal 40 years before we had the apologies in Parliament and the promise of compensation, perhaps up to £2 million per person. How long will it take for this to come out? Your prognostications are just as good as mine. Now, on a lighter note, a much lighter note, Bob Jackson has kindly sent me a portrait. Now, I've no idea who it's of, but I'll let you see if you can work it out for yourself. So I thought that was very kind of Bob. So thanks for that, Bob, very much. You know, no one's ever painted an oil picture of me before. Probably be the last time as well. But let me know what you think. There you go. Thanks, Bob, and let me know what you think. Anyway, you've got to lighten things up after such serious issues. This is going to come out. It's a case of when and how quickly, and if it's in my lifetime. But for now, as always, thank you for watching, and do check out the article for yourself. Completely readable. We're only going by the evidence that is provided in the peer-reviewed literature. And it's good that it's starting to come. Thank you.